Hello everyone. Today topic is anemia. So anemia is the term that is very familiar to everyone. So now in our there is a survey, that is a National Family Health Survey. It is came to know that the female, around 55% of female in our populations are affected with anemia. It is maybe the cause, that is slow socioeconomic conditions, as their intake of food is less as compared to the male, and also every month they have to menstruate cycle, they go through the menstrual cycles. These are the main causes for why the female are more seen to be anemic as compared to the male. So in this video we will discuss that what is anemia and its classifications and how it will affect to the different part of the organ. So commonly anemia is the condition in which the hemoglobin as well as the RBC, that is the erythrocytes, both the two factors, their level is decreases. So low RBC and low hemoglobin that will leads to anemia. So what is the definition? So it is in conditions. So anemia is not a disease, it is the conditions in which the number of RBC, that is the erythrocytes or the red blood cells, or the hemoglobin concentration, that is HB, within the blood is lower than the normal. So if the RBC that is less than 4 millions per microliter, or the hemoglobin concentration, that is 12 gram per dl, less than 12 gram, that condition is called anemic. So what happened? Due to the low level of RBC and hemoglobin, the oxygen carrying capacity of the RBC will be decreases. So this oxygen is very much required to every part of our body. So the insufficient oxygen supply to different part of the organ, that will not meet the physiological or the functions of the body organelles. That leads to gradually dysfunctional of the different part of the organ. So it is insufficient to meet the physiological needs of the tissue, and also per day in a healthy people. So healthy people per day needs approximately 400 liters per day. So the oxygen is very much required for our body, because per day is taking, a healthy human is taking approximately 400 liters of oxygen. So if this oxygen is carried by the hemoglobin, and this hemoglobin is present in RBC. So both are, if the healthy RBC level decreases, that also we call anemic. If the hemoglobin concentration is decreased, that also leads to anemic conditions. If both are seen, that also the anemic condition will be arises. So the pathophysiology, what is say? The decrease in RBC or the hemoglobin level diminish oxygen carrying capacity. So this hemoglobin, later we will discuss, hemoglobin have the capacity, binding capacity, so that it can carry oxygen from the lungs to different part of the tissues. So that leads to insufficient oxygen, that leads to the cause, that is hypoxia. And again this hypoxia induce effect on the different system, organ system, our body, and that result in anemia. So before we discuss more about the anemia, have a look on the what is RBC and what is hemoglobin. So RBC is name is erythrocytes, as its color is red, so it is called red blood cells. And the structure is biconcave. See, this is both sides are a disc-like structure, and the center is the biconcave. So is like WBC, platelets, it is not spherical in shape. It is just biconcave shape, and the both sides are disc-like structure. So this disc-like structure is, so due to this disc-like structure, it has more surface area as compared to the spherical. And this disc-like structure, if you see the hemoglobin, on this periphery area, the more hemoglobins are present there as compared to the center. So the outer layer, if you see, the hemoglobins are more in this periphery area, and it is disc-like structure. So it is called as biconcave shape. And one thing is that it does not contain nucleus and other organelles, as we see in WBC platelets. So it does not contain nucleus and the organelle. Due to this disc-like structure, one of the benefits is that there is more surface area, so more hemoglobin will be present there. And due to this hemoglobin, so hemoglobin, as it is containing the iron pigment, so it is red in color. That's why it is called as red blood cells. And red blood cells count, normal count, in male it is that 4.3 to 5.6 trillion per liter, and in female that is normal range is 3.9 to 5.1 trillion per liter. And due to this biconcave shape, so the RBC that is flow in the bloodstream, that can be moved very narrow capillary also. So in our body we find the blood vessels, veins, capillary, vein, artery, capillary is the finest, very narrow part, the very narrow lumen diameter we see in the capillary. So due to this biconcave shape, and this has the capacity molding himself, the RBC has the capacity, it can mold his structure so that it can reach in the narrow thin lumen of the capillaries. So in one single RBC contain how many hemoglobin? 300 million hemoglobin. So this if you see in the periphery, in the discs, both in the discs, if you see in the structure, the periphery that contain hemoglobin, around one single RBC can contain 300 million hemoglobin. Now we will discuss more about in the hemoglobin. So what is hemoglobin? Hemoglobin is a tetrameric protein. So tetra means 4. 4 protein channel is there. So as protein channel is made of polypeptide chain, so we see two alpha blue that is the beta chains and 2 alpha chains. So total there are 4 protein chains, that is name is tetrameric, and in the center there is the heme prosthetics are there. So in heme prosthetic we see iron is the center, and this iron atom can carry oxygen that is present, that is from the lungs. So each iron, if there is present 4 iron molecules in one hemoglobin, so it can carry 4 oxygen molecule. So that it is tetrameric protein, contain the hemoprosthetics group and 2 alpha and 2 beta protein chains, and one hemoglobin carry 4 oxygen molecule. And what is the function of the hemoglobin? So hemoglobin, as it is contain iron in the center, so it's give a color, red color due to the presence of hemoglobin in the RBC. So RBC is called as red blood cells. And this hemoglobin has the function is that it can carry oxygens from the lungs to different part of the tissue, and also carbon dioxide that is taking away from the tissue to the lungs. And here the carbon dioxide can be exhaled out of our body. So the hemoglobin has one single hemoglobin can carry 4 molecules of oxygens. So if our RBC contain 300 millions of hemoglobin, so if you multiply with 4, then you will find that 1.2 billion of oxygens, one single RBC can carry 1.2 billions of oxygens. So this oxygens is very much required, because per day our requirement is approximately 4 liters per day. So if there is destruction in the RBC, or the red blood cells destruction is more, or hemoglobin concentration is really decreases, so this amount of oxygen cannot be get by the organelle. So this insufficient oxygens does not meet the physiological need of the organelle, and it's gradually decrease the different systems, and the sign and symptoms like fatigue, tachycardia, then breathlessness, hypoxia, and pale skin will be seen in the patients, those who are suffer with anemic, and later it will be affect to the cardiovascular systems and So by knowing all these things about RBC, hemoglobin, so the classification of anemia is done by 2 ways. One is the morphological classification, another one is the etiological classification. Morphological classification according to the structure or the shape of the RBC, on that basis it is classified. But in etiology, according to the cause, it is classified. So it is called etiological classification of the anemic. So one is the dietary insufficiency. If the RBC are produced in the bone marrow by the process of erythropoiesis. For the synthesis of erythropoiesis or the RBC formation, very much nutrients like some of the nutrients, that is iron, vitamin B12 and a folic acid, that was required for the synthesis of the RBC. If there is insufficient intake in our diet, then that also called dietary deficiency anemia. And third and second one is the hemorrhagic anemia. If there is an accident or trauma, in that case we lost blood, so that also be one of the cause. That is one is the chronic and the acute. Acute means if there is any accident, then with blood loss takes place, that is acute cause. And sometimes we seen in our GI tract there is also bleeding takes place, and in piles there also bleeding, there will be continued bleeding will be takes place. So this is called as a chronic blood loss. And the third point is hemolytic. If the destruction of the RBC is more, so as compared to the productions, if the number of RBC was destroyed from the normal level, and in compared to the productions of the RBC, so that is one of the cause, that is called a hemolytic breakdown. And the last one is the aplastic anemia. It is a hereditary conditions, and we all go through all the classification one by one. So I hope you understand about the concept of anemia. Thank you for watching my video. Please subscribe my channel. Thank you.